Good morning, I'm Diane Macedo. Thanks for streaming with us. In today's update, the suspect in the Boulder, Colorado mass shooting made his first court appearance this morning. The hearing marked the first time he's been seen in public since the shooting on Monday afternoon. He's been charged with 10 counts of murder and 1 count of attempted murder. The defense in the case is now asking for a delay to assess the defendant's mental health. AstraZeneca is insisting its COVID vaccine is, quote, strongly effective after the drug maker was accused of using outdated information when releasing the vaccine's efficacy. The new data shows the vaccine was 76% effective overall against symptomatic disease. That's 3% lower than reported earlier this week. That new information also shows the vaccine is still 100% effective at preventing COVID-19 hospitalizations. AstraZeneca is expected to apply for emergency use authorization from the FDA soon, and experts will be sure to be combing through that data from the trials. Meanwhile, more Americans are getting access to vaccines. 29 states and Washington, D.C. have now expanded eligibility to anyone over the age of 16. And as supply increases, President Biden is reportedly looking to set a new vaccine target higher than his initial goal of 100 million shots in 100 days. He's also expected to announce $10 billion in funding to expand vaccine access and build confidence in high-risk, hard-hit communities. And the president is likely to address that today in his first official press conference since taking office. His first solo press conference comes later in his term than it did for the last 15 presidents on Biden's 64th day in office. He's expected to tout the passage of the $1.9 trillion COVID relief bill and his administration's success in ramping up the vaccine rollout. He'll also likely face questions about action on gun control and the growing surge of migrants at the southern border. You can watch that press conference today at 1:15 Eastern, right here on ABC News Live. And New York Governor Andrew Cuomo is being criticized after a new report claims his family, or he rather, gave his family and others special access to COVID testing at the start of the pandemic. The new accusations come as the governor faces investigations over sexual harassment allegations and accusations his administration withheld information about pandemic-related nursing home deaths. Stephanie Ramos has a closer look at the new accusations and the governor's response. Stephanie, good morning.
Hi there, Diane. This morning, another accusation hanging over New York Governor Andrew Cuomo's administration. Multiple newspapers are reporting that back in March, at the beginning of the pandemic, the governor instructed top health officials to prioritize COVID testing for his family members and top associates. According to the Albany Times-Union, those family members included his mother and brother, CNN anchor Chris Cuomo. The tests, allegedly conducted by top health officials at times in private homes, hundreds of miles from the Capitol. Those priority tests came at a time when millions of New Yorkers were struggling to find available testing. The Times-Union says an official within the governor's office claims the testing was done in good faith in an effort to trace the virus. This new accusation comes as the governor faces multiple allegations of inappropriate behavior. Cuomo still denies ever touching anyone inappropriately. Diane.
All right, Stephanie Ramos for us in New York. Thanks, Stephanie. And COVID long haulers are now calling attention to some little-known lasting effects of the virus. You've likely heard about loss of taste and smell, but what about issues with your eyes, or so-called COVID toes? ABC News Live anchor Lindsay Davis has more.
May KRAVITZ and her friends were among the many who contracted COVID-19 over the past year and didn't even realize it.
We went to a friend's dinner and none of us knew that someone had COVID.
She briefly felt sick, but then thought it had run its course.
I felt shortness of breath, but I didn't lose my taste. I didn't lose my smell. I didn't know. So I was sick for like 3-4 days and it went away.
But soon, she started to experience an unusual symptom.
I actually cried about something. I was having a conversation with a dear friend of mine, and I thought that I'm having eye pain and headache from crying, because usually that's what happens.
May and her friends all started suffering from an eye pain that was so excruciating, she called Dr. Jeffrey Della Russo for answers.
And I said, listen, I have something really weird going on. My eyeballs feel like they're about to explode, and I can't move my eyes up and down or to the sides.
At first, Dr. Della Russo thought she might have multiple sclerosis.
So somebody in her age group, female, when they have issues with pain in the eye or particularly pain on eye movements. It sets off certain alarm bells.
But then a realization that the eye pain could be connected to COVID-19.
The whites of people's eyes, it's a mucous membrane, just like you would have your mouth, nose, and nasopharynx in the traditional routes of transmission of the virus. It's perfectly reasonable that that's been, an underlooked route of transmission.
The CDC lists a number of common symptoms to watch out for if you think you have the virus. Many focus on respiratory issues or fever. But long hauler side effects and other possible symptoms like COVID toes, where patients report rashes or discoloration, or even COVID tongue, swelling or lesions in the mouth, have shown there's still a lot to learn about this virus.
We know that a range of symptoms can occur with COVID. It's not necessarily just shortness of breath and fever, especially with milder conditions. It may just be eye-related pain or itchy eyes. That could have been a telltale sign of COVID, but we just didn't know to diagnose or test for that patient, especially early on.
Studies appear to show a large percentage of COVID-19 patients have had eye symptoms. Many had conditions that were generally mild, though some patients reportedly had eye nodules that researchers say could be from the virus.
The vast majority of patients recover within 2 weeks, and so it's very short-lived. But just like the broad range of symptoms for COVID, where we've seen a small portion of patients experiencing this long COVID condition, that can also happen when it comes to the ocular symptoms, which can be a longer duration and take more time to recover or be more severe in nature.
For May, the eye pain was just the beginning.
Anything I did required so much effort that I had to sleep for hours after. It was very uncomfortable. I was nauseous and headaches and muscle pain.
Thankfully, May's eyes have improved with time, but the condition is causing some to question if more eye screenings or protective measures would help.
Thinking about eye-related protection, especially if you're in a high-risk category, makes sense, or if you're in a high-risk environment where the likelihood of transmission is increased.
The CDC does currently recommend that healthcare providers wear eye protection when meeting with patients, particularly in areas with moderate to substantial community transmission. Dr. Anthony Fauci weighed in with our Dr. Jennifer Ashton.
If you have goggles or an eye shield, you should use it. I mean, it's not universally recommended, but if you really want to be complete, you should probably use it if you can.
If you're having a rapid onset of eye pain, I think it's a good reason. It's a pretty reliable signal to go get tested for COVID-19, because it can be an early symptom. Go get a test and begin the isolation and all the best practices that we all have had drilled into our heads over the last year.
And some COVID long haulers have also recently reported that the vaccine has helped alleviate their symptoms. Scientists are now looking into that. Our thanks to Lindsay Davis for that report. And that does it for this ABC News Live update. I'm Diane Macedo. Thanks for joining us. And remember, ABC News Live is here for you all day with the latest news, context, and analysis. Also, a programming note, President Biden will hold his first solo press conference at 1:15 Eastern today. We will bring that to you live. Until then, have a great day.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.